All right, Dad, you ready? All right, okay. So, list some important skills for cardiologists to have, just briefly.
In general, there are two types of cardiology: non-invasive and invasive cardiology. Non-invasive skills are basically, other than clinical exam, echocardiogram, stress test, nuclear cardiology. Those are the main skills. Non-invasive cardiology. Nowadays, there are imagings like MRI, cardiac CT, what we call CTA, and also newer imaging modality, including the nuclear PET. When it comes to invasive cardiology, then the skills are doing coronary angiogram, cardiac cath, uh, stents, laser, and different various procedure for coronary. And the newer, what we call structural heart disease, so closing the hole in the heart like PFO closure, ASD closure, and also uh, the new one which just starting now are replacing the aortic valve without surgery, just from tiny hole, what we call percutaneous aortic valve replacement, and mitral valve repair, again doing non-surgically without opening the chest, just going from small tiny hole in the groin. So these are the invasive cardiology. Then there are something else called other cardiologists, other branches, electrophysiology. So where they go inside and they put pacemakers, defibrillator, and also they treat arrhythmia, which is cardiac rhythm disorder, by ablation, which is going inside the vein and going to the heart and then burning those tissue, well, burning the fibers and the focus of the arrhythmia. So these are the main skills.
Okay. All right. Can you recommend some high school classes and extracurricular activities?
I think high school classes, I'm not sure what classes they have here, but I
Like
think
anatomy and physiology.
that's what I was saying, that you can look at anatomy, physiology. Also, there is on the web a lot of good site called Nectar, or there are a couple of other sites where it gives you complete anatomy and physiology of the heart.
So generally that, and then your basic math classes and.
Yeah, I think if you're interested in that, then I think you need to have science and math.
Yeah. Okay. All right. Any extracurricular, like as in like shadowing or?
I think yeah. The important part is if you want to be in cardiology, then you want to shadow one of the cardiologists. So and shadowing even the regular what we call internal medicine or primary care family practitioner. If you shadow, that also helps.
Okay. Right. What about some college majors or training programs and licenses and certificates that are needed? Just briefly, in a few words.
Licenses for
Practicing.
yeah, I think for training, for us, like going into cardiology, first we have to, after the high school, you have to do pre-med, which are graduate, undergrad.
Mm-hmm.
Once undergrad's done, then you go for medical school, which is 4 years, and then you have to do residency in internal medicine, which is 3 years, and then you have to do fellowship in cardiology, which could be 3 to 5 years.
All right. Are there any licenses or certificates
I think
that you need?
Yeah, so basically what happens to you have to have a board certification in internal medicine, then you have to have board certification in cardiology, and then you may decide to do more further studies that will give you board certification in electrophysiology, board certification in interventional cardiology.
So like whatever your specialization or whatever you specialize in.
Whatever you want to specialize into, yeah.
Okay.
Same the residency for medicine, and then fellowship in cardiology.
Yeah, so that would be a new postgraduate. List some common responsibilities and activities.
Like
I think you covered that though in the first, yeah. And then you covered any differences based on specialization. Where would you work and who would you work for?
Well, there are various ways of practicing. There are people who like to do academic medicine, so they'll work in academic setting in the university.
Mm-hmm.
So that will be academic. But if you want to do practice, then you can start your own practice, or you can join the group of cardiology who are practicing already, or you can work for the hospital, where the hospital will employ nowadays cardiologists.
So what did you do?
Well, right now, well, after a fellowship, I just came and started. I joined a group of cardiology practice, and then, for 10 years, and then 2001, I opened up my own practice.
So, salary range for Kentucky. Do you know?
For cardiologists,
Yeah, like.
cardiologist salary range anywhere between 300 to what do you call 300 to $450,000.
All right. Have I heard of his career before? Yes. One positive thing is that you help countless number of people. And one negative thing, you definitely work long hours, very long hours. I can tell from what Dad is doing. Would I like to have this job? I'm not sure because it does require, it's a big responsibility. And yeah, I covered why not. Okay.
We're done now.
Okay.